Hello, I'm Dr. David Spach. In this brief mini-lecture, I'm going to address the timing of when potential HIV acquisition can occur in people who are prescribed HIV PrEP. Although HIV PrEP is highly effective in preventing acquisition of HIV, there's always the possibility that a person prescribed HIV PrEP can acquire HIV. Therefore, it's important to conceptually understand there are three main time periods when acquisition of HIV can potentially occur in a person who has been prescribed HIV PrEP. First, prior to starting HIV PrEP. Second, while taking HIV PrEP. And third, after HIV PrEP has been discontinued. First, let's look at how someone can potentially acquire HIV before they receive their first dose of the prescribed HIV PrEP medication. So how can this occur if everyone is getting baseline HIV testing prior to starting HIV PrEP? This can happen if a person planning to start HIV PrEP has very recently acquired HIV. In this scenario, the baseline HIV testing may fail to detect HIV, especially if the baseline HIV testing includes only an HIV 1-2 antigen antibody immunoassay. In this situation, the person starts taking HIV PrEP with undiagnosed HIV. As a quick review, after a person acquires HIV, there's a window period where it takes about 3 to 4 weeks before HIV antibody testing becomes positive. Most HIV screening tests also include HIV P24 antigen testing as part of the HIV 1-2 antigen antibody immunoassay. But as shown here, it can take about 17 days after HIV acquisition before the HIV P24 antigen is detectable. HIV RNA assays are the most sensitive test for detecting HIV soon after HIV infection. But even with this test, there's an eclipse phase that typically lasts about 8 to 10 days after HIV acquisition when HIV RNA testing will not detect HIV. So putting this all together, you can see that each of these tests has a gap after recent HIV infection before they turn positive. Thus, HIV testing is never 100% accurate in detecting very early HIV infection. So I'd like to emphasize 2 points related to detecting recent HIV infection in someone who's about to start HIV PrEP. First, initial screening with HIV antigen antibody testing is better than antibody testing alone. And second, any person with a known high-risk exposure to HIV within the prior 4 weeks should have HIV RNA testing to further increase the yield of detecting recent infection. Now let's look at HIV acquisition that can possibly occur when a person is taking HIV PrEP. If a person is taking daily oral HIV PrEP and they acquire HIV, it most likely occurs during a time period when there are major gaps in adherence, as shown here. In this situation, HIV infection can occur because the concentration of the HIV PrEP medications inside the human cells is not consistently high enough to prevent HIV replication. Rarely, a person taking daily oral HIV PrEP with very good adherence can acquire HIV, but it's believed this usually involves acquisition of a strain of HIV that has significant resistance to the oral HIV PrEP medications. HIV acquisition can also occur in a person who's receiving long-acting injectable Cabotegravir, or Cab-LA. This is most likely to occur if there is one or more missed injections, since this would result in levels of Cabotegravir inside the cells that are not high enough to prevent HIV replication. There are rare cases of HIV infection that have occurred in people receiving long-acting injectable Cabotegravir when no injections were missed. So why would this happen? One possible explanation may relate to how Cabotegravir is metabolized differently in some people. In most people, with consistent every 2-month dosing of injectable Cabotegravir, the levels of Cabotegravir remain adequate to prevent HIV infection. It appears that in some people, there's a different kinetic profile with Cabotegravir, as shown in the dotted lines, where they may have a more rapid onset of peak drug levels and a more rapid decline of drug levels. In the setting of these more rapid kinetics, it's possible that vulnerable periods exist just prior to each of the 2-month injections, where levels of Cabotegravir may fall to a level that is not protective against HIV infection. Last, let's look at the potential to acquire HIV after HIV PrEP has been discontinued. Several studies have shown the time soon after a person stops HIV PrEP has significant risk for acquiring HIV. So if a person stops taking daily oral HIV PrEP, the tissue levels of these medications wane over a 7-day period. So potentially, a person could acquire HIV within several days after the last dose of the oral HIV PrEP medication. If a person stops the every 2-month long-acting injectable Cabotegravir, they will have continued protection for about 2 months after the last injection. Although low levels of Cabotegravir may be detectable in the blood for many months after the last injection, these low levels do not reliably protect against HIV infection. So in summary, people who are prescribed HIV PrEP can possibly acquire HIV before, during, or after taking HIV PrEP. Therefore, HIV testing is important for all of these phases.
The production of this National HIV PrEP Curriculum Mini-Lecture is supported by Grant U62PS924588 from the Centers for Disease Control and Prevention and U10HA32104 from the Health Resources and Services Administration of the U.S. Department of Health and Human Services. Its contents are solely the responsibility of the University of Washington IDEA Program and do not necessarily represent the official views of CDC, HRSA, or HHS. This project is led by the University of Washington Infectious Diseases Education and Assessment Program.